you.
I'm not used to seeing you in audience.
I should start by asking a question that I think almost everybody in America is wondering, which is, when is this going to end?
December 2021, we're certainly not where we want to be, right? We have 100,000 cases a day. We have 1,100 deaths a day. We have Omicron that's now here. We also have an extraordinary menu of tools that we didn't have a year ago. So we have fully vaccinated 200 million people in a year. We didn't have a vaccine a year ago. We now have boosted nearly 50 million people. We have an extraordinary amount of science that has taught us about transmissibility, about prevention measures that we can put in place to prevent these things. When I look to what the future holds, so much of that is definitely about the science, but it's also about coming together as a community to do things that prevent disease in yourself and one another. And I think a lot of what our future holds depends on how we come together to do that.
I want to ask you about Omicron, which has been in the news. Can you give us an idea how many cases have been reported in the U.S. and what the characteristics of those cases are?
We have reporting in 19 states and growing. We are constantly in contact with states, and they are evolving from probable cases to suspected cases to confirmed cases. So about 3/4 of them are vaccinated, and the disease is mild. The disease is mild, and so I think that it just depends on whether you're half full or half empty here, right? So far, the disease has been mild. Now, I think we really need to. There's been a lot of media about disease being milder in South Africa, and boy, do I really hope that is the case. Those are early data.
Do you know from the latest count how many had died and how many were hospitalized?
There has been one hospitalization and no deaths.
Of those who were vaccinated, how many had received boosters?
About a third.
You're saying that 3/4 of these first 50 were vaccinated. What does that mean? What are the limitations of the data? And what can we draw from that in terms of, is the vaccine protective against it, and do we need boosters?
We are right now starting to see new studies, the study out of South Africa last night, the Pfizer study this morning, that is starting to look at the laboratory evidence of how our vaccines are working. And they're not going to work as well against Omicron. That's, we've seen. In the Pfizer data today, it looked like the booster actually worked pretty well. And so, and what we don't know is how to translate those in vitro data, those laboratory data, into what's going to happen in people. What we generally know is the more mutations a variant has, the higher level you need your immunity to be. And so since Omicron has a lot of them, we want to make sure we bolster everybody's immunity, and that's really what motivated the decision to expand our guidance on Monday, I guess, for everyone to get boosted.